My name is Russell Rooms, and I'm the nurse practitioner for Diversity Family Health, and I want to talk to you about prevention of HIV. There are basically three ways that we can prevent you from getting HIV. Number one is more about treatment, and we'll talk about that more in the treatment section, but if somebody has HIV and they're on their medication, most likely we can get them to what's called undetectable, which means those people cannot transmit the virus if they were to engage with another individual. So that's one way to prevent HIV, is being on treatment. The second way is through post-exposure prophylaxis, or what we know as PEP. And that is, if you've been in contact with HIV within the past 72 hours, we can give you a medication that will keep you from getting HIV since your body came in contact with it. It's normally 28 days of medication that you will take to make sure, again, that you don't get HIV if you've been exposed. The third way is pre-exposure prophylaxis, or what's known as PrEP. And that is one pill that you take once a day that will prevent you from getting HIV should your body come in contact with it. It's 99 to 100% effective against HIV as long as you're taking that one pill once a day. And that's the only thing, however, it protects you from. Not gonorrhea, chlamydia, syphilis, any other sexually transmitted diseases. So that's why it's still important for you to wear some type of protective barrier like a condom when engaging sexually. While you're on PrEP, we'll want to see you every 3 months for several reasons. Number one is to make sure you're not that 1% that gets HIV while on PrEP. Number two, to check your kidney function to make sure that we're not doing anything bad to your body in the process, because there have been cases, about 3% or so in the studies, of people having some kidney injury while they're on PrEP. The third reason that we would want to see every 3 months is to address any of those other sexually transmitted infections that you may have gotten during the time that you were on PrEP. There are actually two drugs that we would use for PrEP, or pre-exposure prophylaxis, one of which is Truvada and the other which is Descovy, and it would be up to your healthcare provider to determine which one is best for you. I hope this has been informative and you've learned a little bit about ways that you can prevent getting HIV. Again, my name is Russell Rooms, and you can find me at Diversity Family Health at www.diversityfamilyhealth.com, where we can address all of your sexual health needs along with some of the other partners that you've met during this presentation.